Dr. L H Hiranandani Hospital, a leading multi-specialty hospital in Mumbai, state-of-the-art robotic system for knee replacement surgeries. The launch ceremony was graced by Dr. Niranjan Hiranandani, CMD of the Hiranandani Group of Companies. As the chief guest, Dr. Sameer Kulkarni, CEO of L H Hiranandani Hospital, Dr. Manish Gupta, Medical Director and Dr. Sanjeev Jain, a full-time orthopedic and joint replacement surgeon at the hospital, were also present. Dr. Niranjan Hiranandani, in his address to the media, highlighted the hospital's commitment to excellence. "We are proud to house the Center of Excellence for Joint Replacement," he stated. "Our team comprises some of the most esteemed orthopedic and joint replacement surgeons specializing in knees, hips, spines, and sports injuries. Now, with the acquisition of this robotic system, their expertise will be further amplified. This technology not only ensures exceptional accuracy and precision during surgery but also streamlines the entire process," Dr. Hiranandani emphasized. "It signifies the perfect blend of human skill set and cutting-edge technology, a combination proven to deliver the best outcomes and patient relief. Consistent infrastructure and technological upgrades remain a core focus for our hospital management." Dr. Sanjeev Jain, joint replacement surgeon who will spearhead the use of the robotic system, elaborated on its benefits. "The robotic system eliminates variations between surgeons and facilitates precise cuts, minimizing tissue trauma and blood loss," he explained. Dr. L H Hiranandani Hospital's adoption of this advanced robotic system signifies a significant leap towards offering patients minimally invasive, precise, and efficient knee replacement surgeries.
To explain to you that we are now moving to the next level. So there is a positive story in terms of it. The details of that, I'm not the right person to share. So Dr. Sanjeev Jain, who looks after the entire department, and our other doctors will share with you what is it that we will bring to the patient care that we do. So ultimately, what is the idea of this hospital? Dr. L H Hiranandani was the founder, was Padma Bhushan, ENT surgeon who did a lot of ear, nose, throat work, and it is after his name that this hospital was created. But the idea was to see that we always bring patient care to the next level, and that is what we are very proud of. So today, this is one more step in that direction which we are doing, and hence I am delighted to do. If there's anything question for me, I would love to do it, because then I will leave, and I leave you to the persons who are over here to take it. Dr. Sameer is the CEO of the hospital. Dr. Manish Gupta is the medical director, and Aditya Sai, who's in the sports medicine segment, is doing fantastic work, but excellent work that is happening. So they are the persons who will actually give you the further details, both of the equipment, the benefits of it. I know some of it, but I don't want to be the expert who really shares that knowledge. So I'm going to excuse myself, and you will take care of this matter. Sure. Thank you so much.
World branded company from Johnson & Johnson, and it's called a Wellness system. Now whenever we do any surgery, the thing is that whatever steps you follow, it should be very accurate, it should be very precise, it should not traumatize the soft tissue unnecessarily. It can be done with a smaller incision, and of course the blood loss can be less. But what happens in the knee replacement surgery especially, you must have heard that the people are not happy about the knee replacement after having it done. But it's not the case. Okay, now it's like if a pilot is not trained, or the passenger who is not even trained to sit on an aircraft, he'll find that it's not a good thing to fly. So the same way the patient has to have a mindset to have a surgery done, one. Two, the second thing is that surgeon, or who's a pilot, or a whole system should be trained to do that surgery first. It's not, the robot is not new in the medical science. It's there for years together. But here we are working in a system for last 20 years. Now when the surgery has to be done of this variety, everything is too precise. So what happens is, in a knee replacement surgery, you must have seen the patient comes with a bent leg or the deformed leg. That means there is a deformity, there is a soft tissue problem, and the knee is arthritic completely, and we need to replace with a joint which is a metal and plastic in a layman language, but it's a very high grade metal alloy and high grade plastic. Now that when that has to be fit inside, it has to be so accurate that you need to match near to the God-given cartilage. In all 3 dimensions, not in 1 dimension, 3 dimensions, sagittal, coronal and axial, dimension 1. So your alignment of the component remains good or accurate or precise to the God-given, 1. 2, whatever the ligaments or structure around are there, there has to be balanced in such a format that the knee can function properly. Otherwise, it's not easy for a surgeon to put a knee, otherwise anybody can put the knee inside. It's like a very, very high grade precise medical, biological carpentry. Okay. Now, the same time what happens is the patient should have less pain as well. Same time what should happen, that patient should have a very fast recovery. Now today, when we talk about the recovery by doing this, today our patient goes after 2 days to the home. Now, with this system possibly we'll try to reduce half a day or 1 day. That means we can target, today world is talking of the daycare surgeries. Whether we can perform the daycare surgery with this robotic, it's possible. But we need to select the subset of the patient and we need to bring it to technology. Now, if you may ask that there are so many robots in the hospital, other hospitals, maybe for the knee replacement as well. So what's new in this hospital, what you have it here? What we have it, we are following system for last 20 years. We had been providing excellent, good long-term results. We have practically no complications, no failure. Then what we are adding it here, with the machine and technology, the experienced system and experienced surgeon there, who can work better than whatever is available anywhere in the world. So we can give you the better results to our patients, precise results, accurate results, well-aligned knee and well-aligned function for the patient. Same time, recovery is quite quick and fast, and we are looking for possibly in the future the daycare joint replacement surgery in the knee. This is for the knee, but we'll upgrade it to a hip and also the shoulder and other orthoplasty. Now, this system works like this is the one part of the system, which is a camera, and this is the other part of the machine which is attached to the table and works. Now, this is a robotic arm here, where when do a knee replacement surgery, there's a system which is saw works. Okay, there's a saw which cuts the bone. Now, what we do during the surgery on the knee, we put certain markers. There's a flow of the system or technique or technology which is catched by infrared rays by this camera and goes there, and everything is calculated precisely, or data is captured, okay, in this. This data is integrated with this system where robotic arms start working. Now, when my knee is like standing like here, when I switch on this system, the robotic arm automatically comes there to the knee joint and give me where the cut has to be done accurately, precisely. So I can precisely cut where, okay, using this robotic arm and the saw. So there are many cuts to be made to the bone, one. The same time when I put the component inside, how well they are placed, how they were aligned inside is been seen. And then finally, the soft tissue titration or the release, because it's a biological kinematic joints. Knee has to bend and function. Okay, so it has to be a stable joint with all soft tissue balances in up to the complete degree of bending in all the planes. And that is also precisely accurately seen on table live on the screen. Now, if you find as a surgeon that something is not correct, you can rectify there and you can see the rectification effect on the screen, what is happening.
Great.
So that can give you again a very precise cuts, very precise alignment, soft tissue balancing, good kinematics of the knee. So you can predict excellent long-term results, better function for the patient, better recovery, and of course when you align everything correctly, all the things are balanced correctly, the patient will definitely have a less and moderate pain or no pain. So there is a lot many benefits from using this system, and I'm sure that this technology is going to at least do good for the Mumbai's patient. And it's not that the other hospital doesn't have, we want to name that, but we are going to definitely have an edge on any of the hospital in robotic knee replacement surgery, because we have been practicing for 20 years in the hospital. As myself, I was practicing for 33 years in joint replacement surgery. So I can deal the robots like a baby, okay, And it's not that the robot is going to do the surgery, it's a surgeon assisting the robot doing the surgery. Then only it can be done.
Since there are two knees to be replaced,
Yes.
so pair of knees.
Yes.
So how much duration it takes for changing the other pair?
So basically, technically, see, it again depends. It's not that duration of the surgery is very important, but on an average, we take around half an hour to 45 minutes to do one knee.
One knee. Okay.
When we use this system, you might use 10 minutes more because you need to put the system into the place and other thing, or 15 minutes more, 1 hour you can say. But as you do more and more number of surgery, though we were doing computer navigation since 2006 in this hospital. So for us, it's not a new, but it's a robotic arm which is going to assist us. Okay, so our time will be practically the same, maybe 45 minutes to 1 hour for one surgery. Other knee is the same because you have to just do the other side. Both the knees can be done same way.
And both can be done simultaneously, or does it take
So we do most of the patient, more than 95 to 98% patients simultaneously who needs it, who is ready for it, who is willingly ready for bilateral knee replacement simultaneously, same day, same go. After doing one knee, other knee, same day. Okay, so where we keep the patient's safety. See, why the patients are afraid for bilateral knee, but they feel it's not going to be safe. One, they'll have a lot of pain. Two, they will not be recovered faster. Three, but we have overcome all these possibilities and they have no pain. They can recover the same way, and of course they are managed beautifully because we are working in an institution, so they are backed up for all the complications which we can predict, which will not happen, and we touch wood, we have no complication, so we can safely do it. We do that very thorough cardiac, especially the cardiac checkup, where we can determine that anything which will not affect their heart condition. And if that is the case, we defer the surgery and we ask them to go for a cardiologist to see, and then if everything is okay, then we have surgery done.
So what is the success rate of this?
So see, the literature talks about two ways. Percentage, people ask, कितना percentage होएगा? पर medical science में कुछ percentage नहीं होता है. We talk about, good, moderately, okay, or better, or excellent. So far, we have been able to produce an excellent result with no complications in 20 years for any of our patients. And this can be found out, we can challenge it openly by talking to any of number of patients randomly.
But are there any risk or complications involved in this robotic system?
In general, no. In general, no, because that's very important question. Okay, because it's like somebody who's driving, he doesn't know even the driving, has been given the BMW and Audi to drive, and that went Mumbai road. So if you have an experienced team, experienced surgeon, who has a good training, who has enough experience doing a non-robotic things like conventional thing, then that surgeon can perform very well. So it's like, if you don't do it, it's like GIGO, like garbage in, garbage out. Whatever is going to feed the data for the system, that will come out. So with an experience, if you don't feed it, you will have a problem. But in general, they are designed so well, usually there is no problem at all whatsoever, you say. So there's no complication as far as, of course, this system also has a boundary, like when a bit of bone, beyond that marking, this marking has to be done, there is shaping has to be done, morphing has to be done, morphing has to be done. So beyond that line, if you go, the saw or the system will stop. So it will not cut which is not required. So definitely we need to use our brain, robotic, artificial intelligence and experience there.
So is there age का क्या है कितने साल से कितने साल तक? Because there are older people who don't want to, like, they are hesitant for knee surgery or like.
Yeah, so see, it depends upon, see, if patient is medically fit, okay, and if they are able to sustain the surgery and they're willing to undergo, we can do the surgery. The highest number of age, we have done it in this hospital, both the knees, 104 years.
Great.
One shot. So you saw the patient who went away last September from here. Okay, the patient wanted to do it. He was very painful. He was on the bed for many years with the pain. They wanted him to even painless on the bed. Forget about anything. Okay, recently I have done a hip replacement for a 111-year-old patient in this hospital. Patient is still in the hospital. So its age is not the criteria. Patient has to be mentally fit, physically fit, and of course medically fit. surgeon should have guts to take that challenge, and of course your anesthesia team and system behind who's backing up should be able to take that challenge.